And good morning, good afternoon, everybody. Thank you for joining. Specifically, I'd like to mention participants from the many countries that we have on the line today. I won't go through the entire list because there are many countries represented, but thank you all for making the effort to join. Today's webinar is really a follow-up webinar of one that was organized 2 weeks ago, during which we discussed issues around the macro-fiscal impact of the COVID pandemic to countries, and basically highlighting the fact that the current pandemic not only causes a health shock to many countries, but also an economic shock. During the last webinar, we had some panelists from countries reflecting on experiences so far in their countries and the measures that have been taken and the consequences they're already seeing. Today, we'd like to follow up on that and really offer all of you, country representatives and other partners on the line, the opportunity for more questions and answers, to share your own experiences, interact with the panelists that we have on the line today, but also to flag to us what kind of support that would be useful going forward from agencies such as the one represented on the call today. So really, I really want to invite you all to share your comments, questions, propositions through email. Perhaps, Joy, we can put the email on a bit longer on the screen. We'll be keeping track of those while people are talking and make sure to address as much as we can and also follow up afterwards. I'd like to start before introducing the panelists. I'd like to start by perhaps introducing myself. Sorry, I should have done that in the beginning. I'm Ellen Van de Poel, and I lead the health financing work in the Global Financing Facility. I'll introduce the panelists shortly, but first I wanted to give the floor to Iryna Postolovska, who is an economist in the World Bank, and she's prepared a short introductory presentation to set the scene, to highlight the topics that we're going to reflect on during this webinar today. So, Iryna, I'd like to give the floor to you. Thank you.
Thank you, Ellen, and good morning and good afternoon to everyone. Joy, will you be able to share the presentation, please? Perfect, thank you. I think for those that connected to the webinar a few weeks ago, the presentation will look very familiar, but we just wanted to give a quick recap to make sure that we're all on the same page. Next slide, please. So as we know, COVID-19 has hit countries with a double shock, both health and economic, as the number of total confirmed COVID-19 cases increases. Countries are facing unprecedented challenges in financing health, both in terms of meeting the increased expenditure needs to treat the critically ill COVID-19 patients, as well as to increase testing capacity and other services. At the same time, countries also need to maintain core essential services and address the growing pent-up demands that will likely materialize once COVID-19 subsides. Next slide, please. Many countries have already implemented stringent measures to stop the spread of the pandemic, and this includes lockdown, social distancing rules, and closure of all but essential businesses. And the map here presents the Oxford University Government Response Stringency Index. And these data are as of May 23rd, 2020. The darkest color, the blue, dark blue, represents the most stringent measures, and this indicator is a composite measure of 9 indicators, including school closures, workplace closures, as well as travel bans. As we all know, this has been necessary to slow down transmission. At the same time, though, this also has a direct impact on economic activity and puts many people and firms at risk of severe hardship. Many health systems were overstressed and underfunded to begin with, and the pandemic's economic fallout further constrains national fiscal capacity. At the same time, additional expenditures will also be needed in disease surveillance, including large-scale testing and contact tracing, before countries can safely lift these policies. Next slide, please. The macroeconomic outlook under COVID-19 looks very different than it did a few months ago. Most countries are facing declining GDP growth, declining revenues, and while rising expenditures. Next slide, please. The pandemic is expected to push a majority of countries into recession this year, with output contracting in more countries than during the global financial crisis. Most countries will see real per capita GDP growth contract in 2020, with a few notable exceptions such as China and India, but even in these countries, real per capita GDP growth will grow at a much lower pace than it did before COVID-19. There will be large declines among commodity exporters, particularly those exporting oil. In countries like Nigeria, real per capita GDP will decline by more than 5%. In addition, countries that are dependent on tourism, trade, and remittances are also particularly vulnerable. Across the board, GDP is expected to contract, real per capita GDP is expected to contract by more than 4%. And in low-income settings, this will be close to almost 2%. Next slide, please. At the same time, countries are facing rising expenditures, and IMF estimates the COVID-19 related spending needs to amount to $3.3 trillion. And countries have already pledged to increase government health spending. This ranges from 0.2% of GDP in emerging economies to 0.5% of GDP in advanced economies. Given the large declines in GDP, however, this could still mean falls in government health spending per capita in 2020. This is something that countries need to be mindful of. Overall, expenditures are expected to increase by 3 percentage points of GDP as compared to previous projections for 2020, and revenue shares are expected to take a hit, and overall fiscal deficits are expected to widen, particularly in more advanced economies that will have a more pronounced projected economic contraction. This means that fiscal deficits and debt ratios will also increase, and global debt is estimated to increase by 13 percentage points to reach 96.4% of GDP in 2020. Of course, there is large uncertainty around these figures, and this will depend on how effective the global response to the pandemic is. Next slide, please. As mitigation policies exert macro fiscal effects and public revenues shrink, countries have already introduced fiscal and monetary policies to address COVID-19 and to contain the spread of COVID-19 and to care for the critically ill, to protect people and firms in financial difficulties, and to stimulate economies. Substantial new funds have been allocated to COVID-19, and here it is important to understand how those resources are mobilized, whether there's reprioritization of spending across sectors or within the sector, and what this would mean in terms of the sustainability and resilience of the system moving forward. At the same time, some governments have also reduced taxes and tariffs to relieve the financial burden on households and businesses, and this has reduced revenues at a time of declining GDP growth, and at a time when the need for increased spending is rising. Policies such as elimination or reduction of import tariffs, however, also affects the price of medical goods, and this might potentially be a fiscal benefit, given that this would mean that you would need fewer financial resources to achieve or to procure the same amount of goods. There's also income support to households, and this is important for nutrition and access to other services. At the same time, countries have also used monitoring policies, including interest rate cuts, reduced reserve requirements, and increased government borrowing. And increased spending in all areas has also been supported by quantitative easing, mostly increasing central bank loans to finance government deficits. So this is a quick overview, and Ellen, over to you. Thank you.
Thank you, Iryna. This is very helpful to set the scene. I've been seeing quite some messages in the chat box, some people flagging they can't hear. So just to reiterate what Joy said in the beginning, the default sort of thing to do in Kudos is to refresh your screen. So please try that. And if that doesn't work, then you can send us a message to the chat or contact operator, as Joy just explained. But please do try and refresh your screen. So after this brief introduction, which very much clarified the big issue, the fact that countries are not only dealing with a health shock, but also a very severe economic shock, I'd like to turn to our panelists that we have on the line today to ask for a quick reflection. And again, to all of you, please just submit questions and thoughts as we go along, and I'll try to integrate them in the questions that I'll ask the panelists. So I have a few questions to ask them to get us going, but please don't hesitate to start submitting your own thoughts and questions, and then I will pick from those. So I would first like to introduce the panelists that we have on the line. That is Mark Blecher, Chief Director, Health and Social Development of the National Treasury in South Africa. We also have Christoph Kurowski, Global Lead Health Financing in the World Bank. Dave Coady, Director Fiscal Affairs from the Director Fiscal Affairs Department from the IMF. Srinivas Gurazada, Senior Public Financial Management Expert from the World Bank. Joe Kutzin, Coordinator for Health Financing Policy at the World Health Organization. So we have all of these people online, and we'll direct questions to them as they come in and as appropriate. I'd like to first move to Mark, given that he's based in South Africa and very much living this economic shock at the moment, whether he could give us briefly a sense of the situation in South Africa, the economic impact of the pandemic on the public budget and microfiscal situation, and the measures that are being undertaken already. Mark? Floor is yours.
Okay, thank you very much, Ellen. Greeting colleagues from all over. My name is Mark Blecher from the National Treasury Ministry of Finance in South Africa. So I'll quickly talk through a couple of areas. So there obviously has been a big load on the health system, even though, of course, none of us have a vaccine or treatment, particularly in the areas of personal protective equipment. The very first budgetary allocation we made was 465 million for PPE. Health workers are potentially very affected by this epidemic and have to be protected. Testing and screening interventions, track and trace interventions, also through our National Institute of Communicable Diseases. We have 60,000 community health workers in South Africa who go out and do testing in the community. Once you test positive people, those who can't self-isolate, one needs to have quarantine and isolation facilities. And for people who are very sick, obviously, one needs to have a plentiful supply of oxygen and high care and ICU facilities in the public and private sectors, and where necessary to put up field hospitals. Specifically in the health sector, we've also tried to contract private as well as public services. We're looking at contracting our first private hospitals for ICU beds over the next coming days, and our minister is putting out a tariff for those ICU beds. It looks we're heading into an adjustment budget process now. It looks like we'll allocate about 20 billion, which is about a 10% increase to our health budget. About 15 billion of this will be through our provinces. We have 9 provinces in South Africa and 5 billion through the national department. And we've had to use various PFM techniques to allocate these funds, including through disaster funds, environments and reprioritization, an early adjustment budget, and a Section 16 emergency allocations. Besides health, we've had a lot of pressure on social security and income protection, with massive problems with the economy closing, loss of millions of jobs, a great emergence of hunger, long food queues. We're having to allocate about 50 billion rand across all the social grants, especially the children's grant, and we've a new cash social relief of distress grant to adults. And our income protection intervention is likely to cost over double our health intervention. Now, coming on to the fiscal sides, the epidemic is triggering a substantial recession. In one scenario, which was put out with 3 different options, depending on the length of the duration, we could have a GDP decline of 5%, 12%, or 16%, depending on duration and the strength of the lockdown. I mean, I've never seen anything before like this in terms of shutting down virtually an entire economy. On the revenue side, there have been massive drops projected, like a 250 billion rand reduction in revenue. That's about a $25 billion reduction, with GDP dropping, firms being closed, having no income for 2 months, and various measures to assist with the survival of firms, like deferring tax payments. And in one scenario, we project that revenue will decline by 27 to 32%. At the same time, expenditure is increasing. The President and the Minister of Finance announced a 10% of GDP response, including across health, social, and unemployment insurance sectors, various others, loan guarantee scheme of 200 billion, and so on. All of this is leading to a massive deficit increase, which is likely to exceed 10% of GDP, probably in the order of 10 to 15% of GDP. And what makes it particularly difficult for South Africa is our country went into this pandemic in a weak fiscal position with a 6.7% deficit even before. So this is probably the highest ever deficit we've seen. Our debt to GDP ratio could rise as much from 50 to 90% of GDP. And that in itself is not the problem. The problem is the massive increase in interest payments, which is likely to exceed health and social security payments. We've had to increase bond sales and for the first time substantially engage as a country in lending from international financing organizations like the New Development Bank, the African Development Bank, the World Bank, and possibly also the IMF for the first time. On the monetary policy side, our Reserve Bank has cut interest rates by 2.5% to make borrowing easier, and done other measures to make it easier for banks to loan funds to firms and individuals in distress. Just to close off, I think we found it very difficult to get the right balance between public health interventions and protecting the economy and jobs. We took a very early intervention in terms of closing borders and a very tough lockdown. We've been 2 months in lockdown, but this has become very difficult to sustain with the economy really diving. And we've now have to move to a more refined approach to prevent economic catastrophe. So we're now starting to come out of the lockdown into a form of a refined strategy, even though the epidemic is still growing slowly. I think for time reasons, let me stop there, Ellen.
Thank you very much, Mark. Could you mute? I don't know. Yeah, thank you. Thank you very much for painting this very bleak picture, actually, about the situation in South Africa, which I assume is not very unrepresentative of what is happening in many other countries represented in this webinar today. I wanted to move to Dave now and ask more generally, after hearing from Mark, how this increased debt to revenue ratio that Mark laid out, how this will affect the public budget, especially for health in the longer term, and what sort of measures countries should be thinking about already now, and the type of support that IMF is also providing with this. Dave, can I give you the floor? Over.
Hi, Ellen. Can you hear me?
Yeah, we can.
Okay. Hi, everybody. Good morning. Good morning here, at least. So I just wanted to make a few points, I think, that would add to what Mark has been saying at an international level a bit. I think what we're seeing here now is that there's a very clear link between strong health systems and economic activity. So I think, the old story about his investment and stuff like that, but here we're seeing the real importance of strong health systems, because the trade-off here now between having not strong health systems and having to take drastic action on the economic side, where you do this balance between the economic side and the health side, is very high. The cost of the trade-off is very high. So I think it's a very opportune reminder to us, it's a very strong reminder to us that strong health systems are important for strong economies. And hopefully that will be a window going forward when we decide that we want to keep strengthening health systems. The second thing is, it's a reminder about the interconnectedness of the economy, and as a result, in this context, the interconnectedness of the health systems. The bottom line here is we have to be all in this together, whether it's dealing with the crisis and solving it later on. So that's another clear message that we're trying to give out there, that we have to be in this together, or will we be in it much longer than we need to be? The third point I'd like to make is the role of fiscal policy here. We're giving a clear message to countries from the beginning. You will need to increase health spending. You will need to increase social support. And so that's the message going to countries. Some countries can do it much more easily than others. And lots of countries are having challenges. And I think the World Bank is doing a very good job of monitoring the support that's going out in different countries. And what you're seeing is a huge escalation across all regions of countries who maybe don't have very strong, not just health systems, but social protection systems, that they're actually mobilizing as best they can, with the big challenge being reachability and ability to target whoever has been hit the most. But that's another area. So what you'll see coming out of the crisis is maybe not just a push for more health, stronger health systems, but a capacity to have a support system, an economic support system, which also needs to be strengthened. But the clear message from the fund is fiscal policy has a stabilization role to play. We need to let it play out. So you don't see very much now discussions coming out of the fund about exit strategies. Okay, I think over the next month, you will see a bit more focus on not let fiscal policy take its rightful position in terms of stabilization, but it will be how do we exit in different debt contexts. The type of money that's gone out is what is kind of emergency funding. Like the number I had in front of me here was 22 billion in 60 countries and rising. Everyone's efforts in the IMF has been on getting money out the door. And not, now the key different feature about this money is it doesn't come with conditions. There's no conditionality in this money when it goes out the door. A good thing and a bad thing. The good thing is it allows countries to allocate the funds to where they think they need it. Yeah? A bad thing is when you've got weak governance, you're not sure where all exactly that money is going. Yeah, I think coming out of this, we'll have to revisit the PFM systems. Accounting for that money will be important. Clear signals are being sent that you need to put things in place to revisit where that money has been spent. So there'll be a lot of issues coming out of it. And I think now what you'll see in the fund is a change in our focus. Now that we've got the money out the door in a very short space of time, which is a very resource-intensive activity, it is hard to get money out the door. Will be on debt. The projections are debt going up by 13 percentage points on average, and stabilizing at these high levels for a while. So the real issue there will be, what do we do when we get out of the crisis? Or what's the exit strategy? I'm sure all of you in the health sector are also thinking of exit strategies, as are those in the social protection world. And if we don't think about exit strategies, I think we lose an opportunity to refocus budgets on things like health and social protection. Yeah? There's no guarantee. It depends how cynical or optimistic you are about crisis. I don't tend to think we learn very well from crisis, which is why we have them, no matter what types of big or small crises. But you have to remain optimistic. You have to be ready to seize any opportunities that come out of this. And I think that requires us to now refocus on exit strategies. So I guess within health, but you guys will tell me more, within health, it's got to do with making sure that the money that has gone in, how can you reallocate it within health? So at the very least, I guess, there are issues around things like hospitals. The money, I presume, went into hospitals. Yeah. So these are the type of things people have in the health sector have to be thinking about. The money that has gone into hospitals, does it need to be reallocated back down to primary health care? Is there a primary health care system strong enough to take those funds is the PF system and so on. These are things I learned from you guys. Yeah. So, but I think it's really important. So if we don't get ready for that report, that money will be lost because there'll be plenty of claims on money. So we need to have our ducks in a row if we think we're going to retain that money in health. It could disappear, in my view, as quickly as it arrived. This also applies to social protection. Their systems are very weak in a lot of countries, and they will be looking to retain the large sums that they're spending and reallocate it to strengthen systems. This will all be done in the context of a high debt profile, and the real challenge in low-income countries will be the financing of that, with the hope that it doesn't have to come from speedy consolidation, because when it has to come from speedy consolidation, it comes with money quickly disappearing from the good places, even the good places where it went in, that money will disappear. In many cases in low-income countries, the approach towards managing debt in the international community, I think, is going to be crucial. I think all of that has to play out now, and we don't know where it's going. You know, clearly, the international institutions are doing their bit in terms of how they're dealing with debt. But a lot of the debt that is out there has been accumulated on commercial terms. They don't necessarily follow. So I think the difference between now and in the past is my understanding is the big difference from the macro fiscal is the amount of commercial debt that's now in low-income countries, yeah? Which I guess is not dissimilar to the oil crisis and stuff like that in past decades. So I think a number of things coming in, but for us, we now think our attention has to start switching to exit strategies. And I think this applies to sectors, whether it's social protection or health. They're the big sectors where the money went in, those two areas. Is being prepared to show that you can use that money through reallocation and strengthening systems. If we're not ready to do that, if we're saying if our approach is let us go away and think about it, it's too late. Debt pressures will force that money to go one place or another. So I think that's the big challenge for all of us, is to get ready for that. And I think that's where we really need a lot of collaboration. I've spent a lot of time recently. I think I've seen some of you on different screens over the past few weeks, learning different technologies as for communication. And they're all in the areas of health, social protection, general reform in fiscal and so on. I think what we really need is that from our side, that we start collaborating very closely in advance of thinking of exit strategies. That's the big challenge for us now. Thank you.
I appreciate the point you started off with, that now more than ever it's very apparent how you need both a strong health system basically to also facilitate economic growth. It's a point we've been trying to make, I think, for quite some time now, also with the Human Capital Project, and it's very obvious at this particular moment that without strong health systems, it will be difficult for countries to plan for any exit strategy. So thanks a lot for this. You pointed a few times to the issue of a lot of money being freed up now in the short term to spend on the COVID response, and the challenge with making sure that that's being spent in a transparent way. I wanted to ask Srini whether he could reflect on this issue and perhaps give some sort of do's and don'ts that would be relevant in the short term, but perhaps also, because we had a question coming in from the Global Fund, Alex Winch was asking to which extent you see the current this current movement also as an opportunity for broader PFM reform and PFM strengthening. So perhaps if you could reflect on both the short-term do's and don'ts and the longer-term opportunity. And perhaps afterwards we can also hear from Mark to which extent this has led to any PFM strengthening in South Africa. So Srini, welcome to hear your thoughts. Over.
Thanks, Ellen. Good day, everyone. Those are great questions, Ellen. Thanks a lot for posing. So often what happens with the additional fiscal space created for COVID-19 in terms of transparency and accountability doesn't get much attention. So let me take you through 3 stages as to how this works. We heard already from Mark, Dave, Governments are spending money for sure, which practically means the way budgets are prepared, executed, and evaluated traditionally, that's no longer fully valid. It's changing. So typically treasuries and the public financial management systems would not react the way traditionally they would be doing. There is urgency, and health spending units need money at the right time and the right quantity, and the time is just now. This flexibility in PFM rules would mean emergency procedures are triggered. What would they include? Typically, they may include many things: dropping and suspending some of the traditional PFM controls and rules, treasury instructions, permitting environments going beyond limits, removing the fiscal limits, delegation of authority, permitting single sourcing. Lots of things can happen in emergency situations to make use of this space. Now, we are practically, what we are doing is we are just rushing through. We are going fast. Now, would that not increase the risk of waste, inefficiency, fraud, and corruption? Absolutely. And typical good financial management systems in emergencies would have inbuilt mechanisms to take care of these risks, so transparency and accountability and inefficiency. So the normal narrative is, in emergencies, some of the ex ante controls, the default controls in the which the finance guys would implement, they would be relaxed or diluted, and compensating post controls means you do the transaction but have a control after the transaction is in place to ensure accountability is established. Just for example, if procurements for COVID-19 can be done on a single source basis, then there should be some broader guidance which would come with that to say that these are the commonly used rates right now based on the market research, and there should be some additional protocols on supervisory review of those single source procurements. Another example, so if this system, the financial management system, they are not ready to do the transaction through that, they're doing offline transactions, are there protocols to make sure that all of them are included, captured, exposed, and reconciliation done? So essentially, are we capturing the transactions and also making sure that some level of an control, basic control, is still maintained in terms of efficiency and transparency? What we generally see as trend in COVID times is that this traditional expectation of relaxation of the ex-ante controls by Ministry of Finance and Ministry of Health, that's not really happening. The finance professionals are not really willing to relax a lot of these controls, but what they are saying is, we'll speed up, we'll deliver it, we'll do it faster. Many cases in developing countries, what it boils down is, people are claiming to be following some controls and rules, but actually they are not. They are just short circuiting, which creates a big risk, which means there are no additional post controls to compensate for the relaxed approaches in the ex ante controls, which means there is that accountability gap, which can eventually reflect in at least as audit observations and reports in Auditor General reports, and which can even open up for in terms of a potential scam in some places. Who can fix this? Possibly every stage this can be fixed. It can be fixed at the health facility level, Ministry of Health and Treasuries. So PFM systems need to be flexible for service delivery needs, but also maintain this core controls. At the minimum, are we capturing all the information related to COVID-19 distinctly and reviewing the processes to say that, yes, these are following these accelerated mechanisms for good reasons? It may be tough, but it's quite doable. At the minimum, what they say is, yes, go ahead and spend money if you need to, but keep receipts, record reasons, report exceptions. This process of 4 steps would make sure that some level of accountability and transparency is maintained. Lastly, let me also mention what we are doing from the PFM community in the bank, particularly in the GFF countries. So the PFM staff are working with GFF and health finance, health colleagues and GFF colleagues to support governments in bringing this flexibility in PFM systems while ensuring accountability chain in place through advisory services and knowledge products, technical assistance. If any countries of the countries participating in this call wants to explore that option, please reach out to the GFF focal point of your country, or probably ask me questions later part of this session. There are a lot of knowledge products already on out there on transparency and accountability. In the bank has put together a lot of resources we will share, like WHO has done, IMF has been doing, and most recent one with Joe, we put together a piece called like "There is no calm after the storm." PFM reform, PFM need to be retooled in this context. So that brings me to my last point on that. Like, is it an opportunity? Absolutely. This is opening up for the public financial management systems, which have traditionally had this very strong input controls to more a kind of an outcome controls, and more purposive and more accommodating to the needs of sectors, and particularly health sector. And I'm sure that would, going out of the COVID pandemic, PFM community globally would be focusing on that. Over to you, Ellen.
Thank you, Srini. Mark, just wanted to hear from the specific South African experience, whether you wanted to comment on this particular topic, whether you've seen any of these measures being applied in South Africa, whether you've seen opportunity for broader PFM reform.
Mark is trying to reconnect right now.
Okay, let me then move to Joe for a broader question. A similar question, but broad, not just PFM, but broader. We had a few questions coming in. I saw Miriam Schneiderman, our colleague from the bank, also asking, and our colleague from Indonesia, similar question, to which saying basically that every crisis indeed creates a new opportunity, and to what extent do we see now opportunities for improving efficiency of service delivery and health financing. Joe, do you want to reflect on this question from your perspective? Thank you.
Yes, thanks. And thanks to everyone. It's nice to have the opportunity here today. You know, we always hear, and I think David Coady mentioned this too, you know, are we learning from these crises? You know, well, we're back again in another crisis. So while we always hear that a crisis is an opportunity, and I believe, you know, it is, or we need to treat it as such, right? It's a political opportunity. The issue is whether we and member states, countries, you know, whether we all really mean it. I'm going to point to a couple of areas that I think can deal with some of the efficiency issues, and just kind of thinking also a little bit at the end, longer term, about, you know, what does it mean to really learn from this experience in terms of how we design and organize health financing arrangements. I won't speak to the PFM issues very much. Srini went over that, and as he noted, we have some very good collaborations on knowledge products now with together. Also, I think things coming with the IMF as well. So I think this is a really positive development, and in that sense, that's one way to take advantage of the opportunity. But just to say that I think that this situation challenges aspects of how we have been doing business in a way, but also reinforces some key messages that we've been giving, and that we may take some new life on. And I just want to really speak to two of these in the short run, and then one longer term issue. The short run is really about two things, which is to prioritize core public health functions on the path to universal coverage, rather than seeing as some sort of alternative. And the second is, on the individual service side, the actions needed to remove financial barriers and to think more generally about the rationing of services. So this implies some key choices and challenges, and also opportunities. On the first one, this idea of prioritizing or reprioritizing population-based services relative to the individual ones. This has to do with what we're calling this idea of common goods for health, and I'll say what that means in a second, but saying that should be the foundation for UHC, or thinking of it as step zero. And just to say that we often give lip service to this idea that, of course, yes, UHC includes public health and so on, but I think we know that in practice, it has really focused very much on individual services, on getting people into insurance programs. So now we have the opportunity to correct this. and to kind of say, well, what should be the first priority for government intervention? And, you know, we all learned back long ago, longer ago for some of us than others, but, you know, that this is really about addressing fundamental market failures. And so in this case, what we're talking about with these common goods are things that are really the key population-based functions and services that will simply not be adequately provided through markets. So we can think of things like disease surveillance, preparedness, and so on. And economists can agree on that, but at the political level, it's very challenging because you're investing in things that probably don't give immediate payoff and don't have that political payoff. But that's one aspect, is thinking about the what to invest in. I think in health financing, we also have an interesting agenda of how to finance and organize these things. And this is really, again, an opportunity to address this issue of verticalization in health systems, because this situation is reminding us that there are certain functions that really need to be provided on a population-wide and a kind of system-wide basis rather than separately in each health program, right? So if you think about things like surveillance, labs, information systems, and so on, we want to take what we call this cross-programmatic approach, which means unpacking these, because very often the way that both countries and donors have invested in things like HIV, TB, or immunization is to do all of these things within each program, and then you might wind up with different surveillance systems, multiple information systems that don't talk to each other, and so forth. So this is the chance to put these together. And on the budgetary side, it means that in order to kind of organize your services in a certain way, you may have to reframe and repackage the structure of budgets to support the distribution of resources to those functions. And in a sense, we have to think about combining a kind of, whenever we're integrating, we still have to maintain accountability for specific results. And we need to kind of solve this problem of having a more integrated design and organization, but still enabling specific outputs to be identified and for systems to be accountable for them. On the individual service side, I think what we've identified, and clearly again, and I would argue from an efficiency more so than an equity perspective in the first instance, is this idea of removing financial considerations from an individual's choice as to whether to seek care. I'm saying it's an efficiency consideration because, again, in the context of a communicable disease, you know, this is really, again, about an externality problem here, right? That one person not seeking care because they may not be able to could have consequences for community spread of the disease. So we need to do that, but we also need to then extend our approaches in health financing to look at other types of demand-side barriers. And we've heard a lot of countries that are doing more contracting with non-government providers. I think there's also an agenda here on cash transfers and things to deal with the kind of barriers. Not that we want people crowding into the health facilities, but that we just don't want these financial considerations to be influencing their decision. They're getting a lot of information about how to seek care, when to come, when not to come, and it's simply to remove, especially in this first instance, remove these financial worries from that decision. But all that said, the removal of fees means there's some other type of rationing taking place, whether that is deferring other services, or basically people potentially paying informally and so on. And when the fiscal dimensions of this crisis kick into next year's budget and we start to think about medium-term budgets, we will need to start thinking about, okay, what will be the rationing mechanisms that will be used, right? It can be through supply-side capacities. Ideally, it would be good to be able to target, but in many cases that is not feasible. So it might be doing more geographic targeting. So perhaps having free services in health centers, but maybe not in hospitals and so on. Where co-payments or fees are reintroduced or introduced, thinking about simplifying those in a way that both facilitates people's understanding of their financial obligation, but also limits their financial risk and ensuring their accountability mechanisms. And the last thing I just wanted to say is on this idea of what might be seen as a sector-specific exit strategy. And I'm altering a phrase a bit to talk about building back different and not just building back better. is to identify some of the elements of resilient health financing. In a sense, providing foundations and systems that are resilient to both economic and health shocks. Now, we've heard some of these key redesign issues or design issues around PFM. A lot of this is about getting the resources to the frontline providers with the autonomy, but also the necessary systems to be able to receive, use, and account for funds. So I think that is critical. I think the other thing, really for all countries, it's a big issue in countries with high informality, but we're seeing even in rich countries as well, to mitigate all of the risks that are inherent in linking coverage and entitlement and funding to the labor market. Now, we've argued this has always been a bad idea, the idea that you would go for, let's say, traditional social health insurance in a context where only 5 or 10% of the population is in the formal sector. Both because you're never going to get many people in that way unless you bring in a lot of budget revenues. But it also turns out that it's bad for health security, particularly as people move in and out of employment, in and out of coverage, their data systems are interrupted, their treatments are interrupted. So we need to really elevate this in our discussions on national health financing strategies. And very last thing I'll say, coming back to one point that David made, there has been a lot of efforts over the years, especially last year's, in all of this work. We have to convince finance ministries in their own terms about how important we are in the health sector. Well, I think now everybody knows, okay? So we probably don't need to go overboard anymore in selling this. Where we need to focus our attention and the challenge is to do a better job in our area. And then, I think the resources can be there, but we really need to, again, be able to do a much better job in the health sector and not put everything into proving how important we are. We can prove it by doing a good job. Thanks.
Thank you, Joe. We need to do a better job. That's a good final statement. I wanted to just move quickly back to Mark, who I see is online again, and come back to the previous question on the PFM reforms and the transparency around the COVID response. Perhaps hear from your experience in South Africa. And to add to that, there was a question coming in from chat, from our colleagues in chat who are asking, and I think this is probably more general, we're saying that these COVID response plans have been prepared really quickly, which was needed, but at the same time also therefore they suffer from unrealistic budgets and not necessarily the most efficient priorities and investments. So how do we think going forward we can improve upon these response plans? And this is not specific to you, Mark, but I just want to put it out there because I think it's a question that is quite that will come back from many countries. So for all the speakers to reflect on this. Mark, over to you.
Okay, thanks, Ellen. Firstly, just for colleagues who on the call who work in finance departments, I think a lot of finance departments have been under a lot of pressure through this period. I've spoken to a lot of chief financial officers who've said kind of their health department comes to them, their minister of health or their head of health department, and they just say, we have to put up a field hospital, we have to do this, we have to do that, we have to do it, like all of this, like immediately, like today, not tomorrow. It's like there's a sense there's no budget at all, it just has to be done. So, this puts a lot of pressure on financial staff and they have to think, how do you adapt to this, this new situation? Some of the ways that we've had to adapt, and I did cover one or two of these in the previous seminar, is we had to very early on use a whole lot of tools that we hadn't necessarily used before to get funds moving rapidly. So they included our disaster provisions, our various environment provisions, reprioritization. We're currently busy with an early adjustment budget. So we're doing 2 adjustment budgets this year. We're actually doing a special COVID adjustment budget so that we don't have to wait 6 months to the mid-year budget. Basically, within 2 months, we'll have a whole new budget, national budget. We're having to use Section 25 emergency regulations. We're having to, on the procurement side, use emergency procurement. And then Joe will be pleased to know that we've had to completely restructure some of our public-private interactions, contracts in ways that we've never done before with the private sector, because we've had to harness. It was immediately apparent early on we would not cope with the ICU beds that were in the public sector alone. So we had to see the health sector as a single sector, crossing the public sector and the private sector, and we're having to contract with private hospitals in a way that we've never done before, which is important for our national health insurance. Can I just say also then, just quickly on the interesting question that came from Chad about unrealistic budgets and efficiency. So something we haven't seen a lot, and this is something I think there's a lot of room from the various experts in the, on this call and elsewhere, is we've seen very little cost effectiveness analysis around what are the most cost effective responses for COVID. And what we do have in South Africa, which is very good, is we have a consortium of costers. So we've had Hero and Chai working with the Department of Health with about 4 or 5 different costing experts helping to cost it. And we have this 20 billion costed plan, which has been excellent. So we've had an excellent costing response, which is helping us in the Ministry of Finance to do budgeting. But not very good work linked to this question from the Chad colleague about what's actually the most efficient, what should be prioritized the most, and what are the most cost effective, what are the best buys in COVID. And that's an interesting question. I mean, for example, there has been a bit of a shift. We started off saying that we must pour lots of money into ventilators in ICUs, and then we started hearing more that, well, a lot of patients are dying internationally on ventilators. Maybe we must look at earlier oxygen treatment, even from lower care settings. But even the balance between some of the preventive responses and the curative responses is important. But even macroeconomically, I think we've learned a lot around more refined responses, because we started immediately and just did a preventive complete lockdown, which completely froze the entire economy for 2 months. And now we're finding, well, we can't sustain that. So we're having to go into more refined and nuanced mix of economic and health interventions. So I think there's a lot to learn in terms of efficiency still in this kind of a really strange situation. But as a Ministry of Finance, we have seen this as a kind of once in a lifetime event, where we've had to really act in a way that the Ministry of Finance has never done before. And that's why our President and Minister of Finance did announce a 10% of GDP intervention, set of interventions.
Thank you, Mark. Very good point that I think resonates with many of the participants on the line. We've been getting a few questions from our colleague in Niger, and also from colleagues in the Global Fund, about the issue of domestic resource mobilization. It's something that with GFF, but together with Bank and with Shaw and other partners, we've been advocating for quite intensively in the last few years. Domestic resource mobilization, increasing public budgets for health. And we've been getting quite some questions on to which extent this advocacy is dead until the economy recovers. What can we realistically expect or do in terms of DRM for health? I wanted to move to Christoph Kurowski for this question. Christoph, and also, of course, you can respond to the one that was just flagged about efficiency and cost effectiveness, if there's something you want to comment on. Christoph, are you there? Happy to give you the floor. Not yet. Shall I? Okay, let me just park this then for a minute and move back quickly to.
Christoph is back online. Sorry.
Oh, if he's okay. Well, Christoph, if you're there, please come in. Okay, let me wait a few more minutes and move to Srini, because we've been getting quite some questions on the PFM aspects. Okay, this is a very specific one actually, but a question to Srini from our colleagues in Zambia. How do you consolidate the audits from Auditor General in relation to the flexible PFM systems and identify what are the core accountabilities to be followed on the use of funds received for COVID-19? Srini, you want to comment on this one?
Thanks, Ellen. So the INTOSAI, the International Organization of Supreme Auditing Institutions, they have been globally working on various approaches with other development partners, bank and others, to work out a mechanism so that the audit of COVID, so the COVID related expenditure, is in context. So it's essentially the professional judgment there, bringing together the kind of factors which are the urgency related issues, because if a default benchmark which normally an auditor would use to review expenditure is used in COVID context, practically there are too many of issues which would be flagged as abnormalities which would be addressed. So what auditors, supreme auditing institutions generally are encouraged to do is, as this is progressing, so keep track of the policy decisions of the government. It can be in terms of additional fiscal space, relaxation of the norms, procedures and protocols for various transactions, and then go into a kind of an accelerated modes of quick audits once the recovery takes place. But it would be a kind of a focused audit, which would mean it would be on high risk activities to bring together like what are the, and give quick responses to the executive and the parliament, essentially with the intention to strengthen the systems. So one is to make sure that the current crisis, the created vulnerabilities in the systems, if somebody has exploited that and actually misused that, leading to either inefficiencies or irregularities, bring them out. And not just that, but essentially to strengthen this narrative for ensuring that in future, if there is another kind of a disaster, God forbid, so the PFM systems are in more stronger position to tackle that. Typical PFM assessments like the PIFA assessment, which is done for almost all the countries every 4 years, they do provide some information and insights into how countries could respond into the crises. But essentially, this is an opportunity for the Auditor General's offices and the internal audits to bring all this together, take the past assessments like the PIFA assessment, and in case of health, there is the FinHealth assessment, which is done, which is again another PFM assessment in health. So bring these experiences together and contextualize in the COVID circumstances so that the audit reports are constructive and they advise the parliament and the executive for strengthening the future systems. That's the overall approach the global community on audit is taking these days.
Thank you, Srini. I think Christoph is not back yet, so I want to move to Dave from IMF. A question coming in from colleagues in Indonesia. Does the IMF World Bank have a new normal economic framework to anticipate the impact of COVID-19? Dave, you want to come in on this one? Thank you.
Okay, thank you, Ellen. Very quickly touch on one or two issues before that, maybe, while I have the floor. I think one issue was, are we learning from crises? Early on, I think Joe brought it up again, a few issues. I think we've got to also ask our governments learning from crisis. It's not just us. I mean, what often surprises me is whether it's crises or good policies or bad policies, just lack of commitment to these policies. And that somehow, we have to figure out how to change that. Many of you know I'm a great lover of demonstration effects. We got to get some countries to show these things work, to persuade the others that they're worthwhile doing. The common good, Joe, I know there's a big thing for the WHO, and I think the hope here is that that to do the common, this is the interconnectedness of the economy. We've talked about globalization; it's been over every press, whatever. This is globalization of health. So that program has now got the biggest boost it could ever get in terms of common good. But hopefully that means that what's common to the common good is strong health systems for ordinary times as well. That there's not a competition between those two. It seems to me that, and I'm stepping out of my kind of domain here, but that one of the challenges, whether it's health or whether it's social protection, is that in a crisis you need to reallocate resources. Yeah, if the resources are not there, there's nothing. If there's no system that's strong enough to do the basic stuff every day, there's nothing to reallocate. There's no framework for reallocating. And so this kind of interlink between the common good and national systems needs to be made very clear, that national systems for good times are good systems for pandemics and so on. Country teams. I want to say a little bit about new frameworks, I think, and it touches on the PFM. So I'll go to the question that I was actually asked, unusual for me. So basically, I'll give you some insights into how it works in the IMF. Every country has a team of economists with different skill sets, of which one will be fiscal, but balance of payments and macro type of stuff. Yeah. So all countries have a team. Countries that get money have slightly bigger teams and more regular focus. A lot of those existed before the crisis. A lot more of them will exist after the crisis, for sure. Our jobs are definitely counter-cyclical at the IMF. What those teams are doing all the time now is first setting up. They've gone through the phase now for those 60 countries that have got this RFI program. They've gone through getting the money out to the country. It takes a fair bit of work. There are certain protocols that have to be followed, but it went very fast. A lot of people got nervous about the speed, but things had to be done. And the perfect can't be the enemy of the really good. And then, there's always a trade-off, even in normal times, between trying to get money out there. If we wanted a perfect PFM system or a perfect policy, we'd never give money to anyone to do anything. So I think these are kind of exacerbated in the crisis. But what our teams are working on now is doing two things: helping governments. I'm going to talk from the fiscal side. Helping governments develop packages. So when they discuss with the countries, which they do on a regular basis every day now, they want to know what measures they're taking. Now, it tends to be a top-down fiscal approach, saying, what are you spending on health and roughly what areas? What are you spending on social protection and roughly what areas? Of course, you ask a question, you get an answer, and they'll give them numbers. And then they have to go, what they're quite good at doing is going after those numbers. Yeah? They don't just take those numbers, they go after those numbers and ask, show us exactly what you've done. Confirm this. Our MD likes to say, keep the receipts, because we'll be coming asking these questions. And there will be an aftermath because the RFI money will run out, and there'll be a need for standard fund programs, PRGF programs. Yeah. This is going to happen down the road, but on a regular basis now, fund teams are interacting with the authorities about where they're allocating the funds. So a lot of my work, for example, is responding to country requests saying, country X says they're going to have a package where they're going to spend the money this way. Does that make sense? Now, it's a very top-down approach, so what you won't get a fund guy, hopefully what you won't get an IMF person doing is saying, how much of that is primary healthcare and how much is hospitals? We know nothing about that on the whole. I've learned a lot over the years talking to you guys. And so, the standard fund guy will not and should not, excuse me, will not and should not be asking. That's where this connection has to happen eventually with the sectors, whether it's health, social protection, or whatever. So that is going on. That is the start of a PFM process. Where is this money going and whatever? So that's where our work is, but it has to be backed up by the detail, sectoral stuff. So that's where we have to meet in the country level, is the sector PFM meets with where's the money being spent. And then on the fiscal side, which is nearer to the question I was just been asked, on the macro fiscal side, I think what everyone's attention to in the fund now has been from the very beginning, but hopefully has got better from the very beginning to now of the crisis, that working for new fiscal frameworks, which means in fund terminology, what's the new macro fiscal baseline? The new macro fiscal baseline is still playing it out and is very uncertain. And I think in that world, you don't want to tie yourself to a baseline, but tie yourself to a system that updates baselines on a regular basis. And there are always projections out there, just like there's projections about GDP growth or adjustments, and you take them with a pinch of salt. I tend to take them in a directional sense and attach a bit less to them. But when we shut down the economy, it's not surprising that GDP goes down. This is always surprises me. But the newspapers need something to talk about now because everybody has time to read. But telling me that the economy is gone down by 20%, fine. We just did that. It's not like a normal economic crisis. It's a man-made crisis where we've actually shut the economy down. The real question we're trying to turn our mind to in the fund, and I see the macro guys talking about, is how will the economy recover? So this is the new normal. Is the new normal V? We will go back to where we were quickly as we adjust. Is it U? We will go back to where we were, but not so quickly. We'll be down at the bottom for a while, and we'll go back up after a while. But I think what people think maybe is more likely, but even in the health world, we know we're uncertain about this, that we'll be going back and we'll be going up and down for a while as the pandemic plays itself out. We see countries already opening up. The real question is, will they continue to open up slowly and keep going up? That's the U. The incomplete U is we will never get back for a long time to where we were. So people talking about, will jobs be lost forever? We know in past crises, some of that happened, but I think this is also a different crisis. But some sectors will see adjustment and there'll be a need for reallocation. But I think the focus now is in saying, what's the shape of that adjustment? Is it a bumpy U at the bottom? Yeah, and I think nobody knows. But I think the right approach is to not have a baseline, but have an adjustable baseline. And it might look very different in different countries who have taken very different approaches to doing the lockdown and are now taking different approaches to releasing the lockdown. So I think it's on everyone's mindset at the higher level in the fund and at the team level. But the team level is very much now focused on, for the most part, saying, what's your immediate 6 months look like? Let's get through that because we need to get through that. And let's come out of it knowing what we did. So that's where the country team focuses. At the higher level, I think we really are trying to get to grips with where we think economies are going over the medium term. This is standard fare. It doesn't always get publicized out there because at the early stages of any learning process, I think is a lot more noise to information ratio. So it's best to stay a bit quiet, focus on the present, but be working and preparing, be preparing for what you have to say in 2 months' time. I think that's what's happening now.
Thank you, Dave. Christoph, I see you're back online. I want to move back to you on the question that we've been getting quite a few times, is DRM, domestic resource mobilization, and advocacy for that debt. And also, to which extent are there innovations or mechanisms to ensure that even with a shrinking budget, enough resources remain available for the maintaining of basic services, which, to Mark's earlier point, is probably a very cost-effective investment to make even in the current pandemic. Over to you, Christoph. Still no sound? Okay, we can see you, but not here yet.
Can you hear me now?
Yes, now we can.
Okay, sorry, I had really problems getting in and out to connect. All right, so I think these are some very important questions that have been raised by the countries on domestic resource mobilization. Let me just start by saying I think it has been a wake-up call for many governments on the importance of investing in health and in health systems. So not only in services, but really the pandemic had laid bare many of the system weaknesses and the need to invest in them. And I think interestingly is in the global economic prospects of the World Bank, we introduced now health systems strength indicators in terms of the vulnerability assessments of the economies moving forward. I think that's a strong sign of this kind of wake-up call, that we have to look at the strengths of the systems and the risks to the economy and how countries and economies fare in the future. Now, having said this, if you look back to other crises, even the Ebola crisis, there's huge variation how countries come out of those crises in terms of domestic spending and prepaid and pooled spending. So there's no guarantee that health, even though now we project that spending goes up as a share of government, not necessarily in the short term in terms of per capita spending, how we come out of this situation. And I think some of the issues I think that Dave raised are worrisome there. The first one is how will the recovery look like? Initially, I think for now most of the predictions are as a V-shape, but there's a lot of discussion will it be U-shaped. So will be the economies, will they kick in slower, and with that will be their massive fiscal stimulus just to get demand going in the economies that can crowd out again the spending on the social sectors. And we see when you look back, these are very deliberate policy decisions whether to maintain essential public service and then invest into the system over the longer term. I think the other big risk factors, I think we haven't raised it, but I think Mark touched upon this. We could go from this crisis in a debt crisis in many low and lower middle income countries after this. And so the question is there at all fiscal space in governments to invest in social service and in health? So I think they're big questions, and we have to start tackling them as we move forward. But clearly, there is a very important dialogue to have with countries and in countries about how do you invest in health system, how do you want to come out of this, and we all hope and we all work that we hope we come stronger out of this. The second question with respect to this is okay, if you look at the numbers right now, spending goes up in health, but and I think the earlier conversation indicated already in the previous seminar that financing currently is not the issue in countries. And in particular with respect to the issues that we have disruptions in essential health services. This seems to be currently more supply and the demand side issue. And that could take us back if then a financing crunch comes on top of what we see in terms of supply and demand. And that could take us back a long way in terms of the progress that we make towards universal health coverage in countries. So I think there are really big questions about how we mobilize the resources and how do we prioritize in the sector. And that's, I think Joe said already, we have to do better in the system and have to prioritize right now that we maintain essential health services in the countries. And that brings me to the broader question. I think Joe called it Build Back Different, we call it Build Back Better. There's a lot of exciting things are happening right now along very different aspects of the system and system strengths. And we talk about preparedness, response capacity. We see that benefits package get changed, that there are efforts to remove financial barriers. We see a whole new world happening on the purchasing side with the private sector. Also on hospital payment systems, we see a move towards a whole of government approach, in particular when we think about the links between health and conditional cash transfer systems. We see health high-risk groups now integrating into CCTs. We see the conditionalities change. So I think there's a lot of good that happens, but what we have to bear in mind, and these good things, they have to be institutionalized and rolled out. But what we have to bear in mind, there will be a lot that has to be rolled back as well. And that may be politically very difficult. There's the entire PFM agenda, and hopefully most countries opt for sunset clauses in some of those changes, but that is a high risk that the system gets more inefficient if you don't roll those back. And the second one is, I think somebody raised this already in terms of the prioritization. The response plans may not got it right in the first place in terms of the investment, in terms of the long-term sustainability of the systems. We invest in hospitals, we invest in ventilators, in intensive care. The question is, how do we basically manage those investments in the long term. They have impact on recurrent costs. They're certainly needed in many countries, but at the same time, they're taking financing away from primary healthcare, from essential services that are not guaranteed for everybody in many countries. So the question is like, how do you recalibrate these systems back as we move forward? So again, just to answer your question very brief, I don't think I have the answers to this, but there are a lot of risks out there that we come out of this crisis actually not better and not different, but potentially worse, and they have to manage as we move forward.
Thanks, Christoph. Related to this, Mark, I would like to ask you this question. Our colleague Michael Borowitz from the Global Fund is asking, to which extent then is the current pandemic providing opportunities to implement new taxes, specifically on tobacco, alcohol, and sugar-sweetened beverages? Do you think that given the sort of dire need to raise revenues, that there might be more momentum around these interventions?
Well, thanks for the question, Michael, and I think it relates to some of the previous questions, also to Christoph on DRM. So in the South African context, and I think this may be the same in quite a lot of other countries, because government and societies have essentially been shut down for the last 2 months, I mean, a lot of firms can't survive for that period. So, you know, there are huge risks of many firms collapsing. And so many revenue authorities have moved to put in place interventions to postpone various revenue payments, which is part of the reason why countries like South Africa are seeing massive revenue shortfalls, which we anticipate going through this period. So I think many revenue authorities are making it easier for firms. So this period right now during the lockdown is not a time for DRM. In fact, it's the opposite. It's actually is reducing tax revenue on many dimensions. It's only after we come out of the epidemic that we can really restart the DRM agenda. In South Africa, we've had a very interesting and specific situation with alcohol and tobacco through the COVID lockdown for 2 months. Alcohol and tobacco sales have been banned for the past 2 months. The reason for this in our context has been, and it might sound a strange decision in an international context, but the reason for this has been that firstly, there was an attempt to stop hospitals being filled by trauma cases because we have a very heavy trauma load in our hospitals and our emergency units. And with the shutdown, with the effective banning of alcohol sales for 2 months, our trauma mortality has dropped by 75%, which is quite incredible. We actually have 800 fewer deaths per week from trauma, linked. Well, I guess a lot of people not driving, but a lot of it is actually alcohol-linked things issued. But on a tax side, we've lost. I think we may have lost 10 billion already of alcohol tax revenue. Now, similarly on smoking, the view of our cabinet, or what we would call our National Command Council, because we have quite a militaristic body leading our response, was that in the face of a pandemic that causes people's lungs to fail, we should ban smoking. So effectively, we've had a 2-month smoking ban, and we've had a tremendous escalation of illegal cigarettes, illegal tobacco. But the tax take from tobacco again has decreased dramatically. So, Michael, we've lost tremendous alcohol and tobacco taxes through this, but our trauma deaths have gone down, and maybe our overall deaths have gone down. But anyway, it hasn't been good for DRM.
Thank you, Mark. Interesting comment. I see Dave and Joe want to come in very briefly. I just want to put one more question out there, and that's specifically, I guess, then for Joe to comment on. But our colleague from Ministry of Health in Zambia is asking, saying he's been following the discussion very carefully, but for a non-economist like himself, and I think there's quite a few among us today, what are the sort of the key actions, or what are ways to ensure that with shrinking resources, essential services can keep on being available. So perhaps if both of you, to the extent possible, could also reflect on that. Dave, can you make your comment?
Thank you, Ellen. I just wanted to touch base on the tax issue and this conversation that comes up again and again, new taxes, a new world of taxes, and put it what I see is a bit more realism in that discussion. I think Mark has got it right in a sense. There's two issues now. One is getting tax systems back to where they were. Tax systems have had to do all sorts of stuff to help the economy. The economy collapsed and you lose revenues, but also tax systems have deferred payments, all sorts of stuff. The types of stuff we don't normally like. So the first thing is to bring tax systems back to where they were and get the revenues that we were getting before. That's going to be a challenge, not just because of the downturn, but because a lot of what determines good tax ratios in countries is strong tax systems and good tax systems with very few exemptions and so on and so forth. So I think that's the first thing that everyone has to focus on. And I know that's what one of my colleagues are working with the different authorities on, is to say, okay, well, do this, but be ready to clean up the system afterwards. Then the next one is about, and this could be a little bit further down the road now, the new tax system. Well, the discussion about the new tax system is not new. We've been discussing the new tax system for a long time. Many of you know, Joe and definitely don't know, is that when we ever hear words like earmarked taxes, we get very, well, you're just focusing on the wrong thing. If there's ever a good reminder of the tensions between relying on alcohol and tobacco taxes to do your health system, and we know there's a number of tensions there, Mark's storyline there is a clincher. So of what can go wrong, that you really want to be getting rid of that tax base very quickly. So it goes back to, so pushing that aside, but it is a useful reminder to us about earmarked taxes. What you need is good tax systems. And we know what good tax systems are. There's no newness in my view about this. We've known, it's a matter of getting them in place. We know in low-income countries, it's going to have to be predominantly consumption-based, consumption tax-based. Now that has implications for other things, like you need a really good social protection system because consumption taxes hit the bottom half of the income distribution too. So there's a big challenge there. None of this is new. This is a repetitive mantra coming from us for sure. So the tried and tested is the way to go. If you really want to go down the earmarking route, soft or hard earmarking, because you really are going to get rid of the alcohol and tobacco fairly quickly, if we do our job. And as Mark has pointed out, the health benefits might be enormous. So the tensions for seeing them as a resource are real. Energy subsidies, another one of my pets. The amount of money we're talking about is much bigger. The health benefits are absolutely huge. Yeah, and we've tried our own way to do some estimates of those when we update global energy subsidies. But again, to do that, you need a package of measures where you're saying we're going to raise this money, but we're going to allocate it efficiently. I think coming out of the crisis, if the new normal does not involve more comprehensive reform strategies, we might be in a new normal that Christoph has mentioned, yeah, which is dealing with a debt crisis on the back foot. And then the best world you're in, it seems to me, is can you protect some of the money that went into the system and reallocate it quickly before it disappears? Now that's when you're on the back foot. But again, it brings us back to preparedness for that discussion. Are we ready in countries for that discussion now to maximize the chances some of the money sticks and gets reallocated within the system? But I think we need to go back to the bigger issue if we want some medium-term, long-term gains, which is I think we need a new normal which is more ambitious in terms of reform strategies. It can't just focus on one sector, health. It's got to focus on all across government type of issues. Education matters as much as health, yeah, and so on and so forth. You know, there's going to be no, in low-income countries, there's going to be no movement towards telework or working from home. As a lot of parents have found out, we now love teachers much more than we thought we did, and we can't wait to go back and have a wonderful education for our kids in school. And that applies to advanced and developing. So there are other sectors out there that matter, yeah? So I think the new normal could be much more challenging than what we thought was previous normal, and we better get ready for that battle on all sides. And on the DRM side, it's two phases. Let's get back to where we were first, and let's quickly use that opportunity while we're getting back to be developing more ambitious reform strategies, which is a bit more cross-government than just talking about health, just talking about social protection, just talking about something else. And what I see, and a lot of you might know about these INFF frameworks, Integrated National Financing Frameworks, which is an initiative by the EU and the UN, with a bit of a delay following on from the Addis Ababa Accord, to go to countries and develop medium-term fiscal frameworks which pulls everything together. We do support that in the IMF, because what we do see is that's what's missing in countries, this medium-term strategy, in our side, a medium-term revenue strategy, but it's a medium-term fiscal strategy. And unless we move in that direction, I think what we're, and you know, believe me, I've seen over the last month different groups pushing, different groups, you'd be surprised, I mean, I'm not mentioning specific, pushing for new funds, new international funds for different sectors. In health, in social protection, education's waiting, it can't get in right now because everything is health. And you know, this is very fragmented at the international level. It's fragmented, it distracts our attention from the country level. This has to move to countries. And I think this, if we don't do that, we'll be back again, you know, we'll be at some international conference next year talking about the same thing without much progress. You know, so I think we need a reality check that it's not all about new, it's about doing what we were doing badly before a lot better. Thanks.
Thank you, Dave. Can I now invite Joe for a final comment? Please keep it brief, but also if you can move towards the sort of within sector allocation efficiency within the health sector, because talked a lot about the micro aspect, but perhaps
I will, but I did. Sure, I will, but I do want to echo and just reflect briefly on what David said. I think a couple of things. One is, I mean, the message on earmarked taxes is very important, and the big challenge, apart from the specific cases like we saw that Mark described, but really a big now is again pointing to the weakness of payroll tax funded social health insurance, right? And that this is one of the main earmarked taxes that is used in the health sector. And I mean, this, again, this situation shows the weakness of that type of approach, which is so subject to these kinds of fluctuations, and that the need to kind of really focus on broad-based taxes. It is going to be predominantly, as David said, consumption taxes in low and middle income settings, taking a very hard look at subsidies that are used to see if they're really necessary, like the energy subsidies, and social protection and health coverage that is probably overwhelmingly non-contributory as a basis for entitlement are things that we need to really look at. So I think that's important. In terms of making, you know, and this point about making within sector decisions that are more efficient, and this point about, you know, not just the general statement of doing better, but really understanding that investing in health systems so that they're functional when during normal times combines not just kind of throwing money at it. Yes, in many cases we definitely need more investment in inputs, more health workers, infrastructure with running water, with connectivity, and so on. But it really means in this case that we don't treat things like health security and the COVID response, both internationally, as David mentioned, but nationally as well. We don't treat them as a vertical program. that it is part of what you do as part of health system strengthening. And doing something different, I think this was one of the lessons that was meant to be taken from the Ebola crisis in West Africa, was not adequately taken. And that these can't be, if there's new funding made available, that's fine, but we have to pay very close attention this time to how that money is channeled to and within countries, so that we don't set up a whole parallel system that is clearly not going to be affordable in the new fiscal context. So it really needs these more unified systems, and designing in aspects of universality, particularly for those functions that absolutely have to function at the population level. And these things can coexist with more targeted approaches to who benefits and so on. So it's really taking that nuanced approach. I think this point just on the essential services part and how to ensure their availability really comes down to some of the PFM issue type things that we discussed about getting funds to the front lines, removing the bottlenecks. And I mean, Srini can probably speak more to those, but I do think this point about real mechanisms to enable flexibility and management, use and accountability for resources at the front line at least enables the providers to actually deliver services to people who come in the door. So I think I'll leave it at that. There's obviously a bigger agenda there, but let me stop there and turn it over to the others.
Thank you, Joe. Very helpful. And just also as a reminder to people that we are keeping track of all the individual questions, and we'll provide a summary note afterwards. I'd like to finally move to Christoph for our last intervention, and also specifically to give the participants a better sense of the type of support that the bank with partners represented today is planning to provide and support with. Over.
Thanks so much. I think if there's one thing that is clear after this conversation is that we will not move back to where we were in 2019, but we will move into an entire new world on how the economies will function, but also how the systems will operate, and how health financing will support this in the right way. And so there are now quite a few efforts right now out there to coordinate our support better among the agencies, particularly in COVID-19. This is under the Sustainable Financing Accelerator of GAP. This is under a new initiative, it's called ACT, on health system strengthening, and that's also on the P4H. And I think we're still discussing what's the most efficient, best way forward, and how to coordinate and work and provide this kind of support to countries that is needed right now. And this is shaping up probably over the next weeks and months. Now, specifically on the bank side, what we did is, first of all, we recognized three priorities, what we have to do differently. The first one is the big paradigm right now is, given that there's so much uncertainties, that we learn faster. We have to learn rapidly in this new environment. That's the challenge. So what we've been doing, discussing with the Global Financing Facility and the health financing work streams of the JLN, because they're all under our roof here in Washington, D.C., we sat together and said, okay, as we all three organizations and initiatives reprogram our work, how can we do this best that we don't duplicate, even here in Washington itself? And so what we agreed on, three things to do together. One is we wanted to provide a platform for exchanges of how countries are developing, what's the views of the policymakers, what are the challenges that they're facing, and how can they exchange knowledge on those kind of questions. So the idea is to develop a community of practice where you can regularly have these kind of conversations. And again, just recognizing for many of the questions we don't have answers, we have to exchange how we address them and learn as quickly as we can. The second one is, and we're coordinating also with WHO on this, is we have to systematically document the responses at the country level in terms of health financing policies to enable that rapid learning of countries, to see who's doing what, in which directions are countries going, is the convergence, the divergence, what are the pitfalls from some countries, what are the anticipated risks that we're seeing. So just to capture this, and we have to do this fairly systematically to enable the learning. And finally, what the three agencies here in DC discussed was we want to launch a repository that it's easy to find information. With information, the problem is always with nutrition. There's stunting and starving, and there's obesity, but it's very hard to find that middle ground. And I think in the beginning, there was a lot of starvation on knowledge on those kind of issues around resilience, and now we're moving into the obesity form, that there's a lot of information out there and how to basically digest for policymakers. So what we want to basically launch is a repository where these things can be easily found and can be distilled. So these are the three priorities we have right now. In addition, of course, we live up to on the bank side to some of our core mandates. So we're working with the fund and others to look at what's the impact on health financing and health spending from the crisis. And we're also looking specifically at the interactions between health financing, monetary, and fiscal policies to enable basically people to better anticipate what the challenges are as these fiscal and monetary policies are adjusted. So these are for us right now the priorities. This is the kind of conversation as we had this morning that's very important as we move forward. Thanks so much, Ellen.
Thank you, Christoph. I'd like to wrap up the webinar at this stage because I'm sure everyone is very busy in this particular time, not only with a lot of work, but also with a lot of the situations at home that I'm sure everyone is struggling with in the current lockdown. Just to wrap up, I think it was, I wanted to thank all of the participants and all of our speakers. I think Mark started off with giving a very realistic, but also bleak picture of the economic situation in South Africa. But throughout the conversation, I think we also touched upon some real opportunities for advancement in the health financing agenda. And at least what I've picked up is that a lot of what we need to do is not necessarily new, but is basically more and better of what we were trying to do before. So if that is well, if not now, then when can we better make progress with this agenda? So just want to also tell everyone, I think most of the audience online knows how to reach Troy. So please do reach out to us with questions, comments, suggestions of support or topics for further webinars. We'll provide a summary note with everything that was discussed during this webinar, and also provide some related materials for your use, but please do not hesitate to also reach out to us and provide suggestions. We really appreciate it, and it will help us tailor ongoing knowledge and learning efforts to your demands. So thank you all. Thank you, speakers. Thank you, audience. It was really interesting dialogue, and hope to touch base with all of you again soon. Over.
Thank you.
Thank you very much.
Thanks very much, Ellen and Joy.
Thanks. Bye.
Thank you.